This is a right clavicle. This is the medial end, and this is the lateral end. And you can tell that it's a right because the medial curve bends out and goes lateral. This is a left radius. This is the head of the radius, and right below it is the neck of the radius. And this is the radial tuberosity. On the distal end of the radius is the styloid process. This is a left ulna. This is the coronoid process. This is the trochlear notch. This is the olecranon process. And this is the radial notch. On the distal end, this is the head of the ulna, and this is the styloid process. This is the hand. Here you have the scaphoid, the lunate, the triquetral, the pisiform, the trapezius, trapezoid, the capitate, the hamate, and here are the loose, and that would be the hamate, the pisiform, and the scaphoid. Here we have the first, second, third, fourth, and fifth metacarpals. And here is the proximal, middle, and distal phalanx. And the thumb is different from digits 2 through 5 in that it only has a proximal and distal phalanx. So this is a patella. This is the base of the patella, and this is the apex. And you can tell that it is a right patella because when I set it down on the table, it falls down to the right. This is a fibula. This is the head of the fibula. This is the neck of the fibula. This is the shaft. And this is the lateral malleolus. And here we have a right foot. This is the calcaneus, the talus, and the navicular. And in their loose forms, we have the navicular, the calcaneus, and the talus. Also on the foot, we have the cuboid, the lateral cuneiform, intermediate cuneiform, and the medial cuneiform. We have metatarsals 1, 2, 3, 4, and 5. On the phalanges, for the metatarsal number 3, we have proximal, middle, and distal. And the reason that the big toe is different is because it only has a proximal and distal phalange. And the arches of the foot, the lateral arch runs from here to here. The transverse arch runs from here to here. And the medial arch runs from here to here. And this is a right tibia. And here we have the lateral condyle, the medial condyle, the intercondylar eminence, the tibial tuberosity, the anterior crest, and the medial malleolus. And this is a right humerus, the head, the anatomical neck, the greater tubercle, the lesser tubercle, the bicipital groove, the deltoid tuberosity, the medial epicondyle, the trochlea, the coronoid fossa, the radial fossa, the capitulum, the lateral epicondyle, and the olecranon fossa. This is a right scapula, and here we have the subscapular fossa, the supraspinous fossa, the spine, the infraspinous fossa. We have the lateral border, the medial border, the superior border, the superior angle, the inferior angle, the glenoid cavity, the acromion process, and the coracoid process, and the suprascapular notch. This is a right femur. We have the head, the neck, the greater trochanter, the lesser trochanter, the intertrochanteric crest, the intertrochanteric line. We have the gluteal tuberosity, the linea aspera. We have the patellar surface. We have the lateral condyle, the lateral epicondyle, the medial condyle, the medial epicondyle, and the intercondylar fossa. This is the iliac crest, which is on the ilium with the ischium and the pubis. We have the anterior superior iliac spine. We have the anterior inferior iliac spine. We have the acetabulum. We have the superior ramus, the inferior ramus, and the ischial ramus. The ischial tuberosity, the obturator foramen, the pubic symphysis, the iliac fossa, the ischial spine, the inferior sciatic notch, the greater sciatic notch, the posterior inferior iliac spine, and the posterior superior iliac spine.